Hello and welcome to the very first module of our Infection Prevention and Control in Care training course. It's an absolute pleasure to have you here today. In this initial module, we will dive into the essence of infection and infection control, the various types of pathogens we encounter, and how infections spread within our environments. Understanding these concepts is critical for us as carers and professionals who care for the health and safety of others. So let's not waste any more time and get started on our journey. Infection refers to the invasion and multiplication of harmful microorganisms. An infection originates from a collection of harmful microorganisms that negatively affect the human biological system if it's given the opportunity to do so. In more simplistic terms, germs cause disease.
A vast range of different microorganisms exist in harmony with the human race and have no effect on a person's well-being, with many having practical benefits for a person's health. However, many harmful pathogens, such as microorganisms that cause disease, can be found in natural elements and will multiply in certain conditions.
Infections are spread when pathogens are passed from their source to a person or from one individual to another. We will learn about how infections spread later in this module. For now, let's look at the common types of infections. Different types of infections are common in modern society, but the two are the most common.
Different types of infections. 1. Systemic infection. And 2. Localized infection. A systemic infection, such as the common cold or flu, will affect the whole body and cause a person to feel generally unwell. A localized infection, such as an infected cut or swollen limb, will only cause pain, irritation, or other symptoms to manifest in one part of the body. The uncontrolled spread of an infection in a facility or localized area can affect the health of many people in a relatively short space of time. Serious forms of infection can lead to people becoming ill and cause fatalities in some cases. Sounds scary, right? Don't worry, because this is where infection control comes to the rescue. So, what is infection control? Well, infection control is the term given to specific activities taken to prevent diseases from spreading from their original sources and eliminate the likelihood of them becoming virulent in currently unaffected areas. The concepts and principles of infection control are important because of the major impact it can have on vulnerable individuals and groups of people. It can also have a significant effect on the working infrastructure of a company or organization. The more employees that become ill or unable to work, the more difficult it becomes to maintain a quality service and cover deficiencies caused by staff shortages. All of these factors can lead to further issues caused by stress, overwork, and levels of expenditure. This is why infection control is a must. True infection control can only be accomplished when sources of infections are understood, as well as the methodologies for preventing the spread of disease. Colleagues and professionals must cooperate to achieve high levels of infection control and follow their agreed ways of working accordingly.
Alright, so far we've learnt about infection and infection control, as well as the importance of these concepts. It's time to shine a spotlight on the culprits behind many infections. We believe you know what we're talking about. You're right, it's time for us to learn about pathogens. Pathogens are like the villains in our story, lurking around and causing trouble wherever they go.
A broad range of pathogens exist, but there are common ones that are encountered more often than others. For example, bacteria, viruses, fungi. Most people think of bacteria and viruses when types of infections are discussed. Let's get more into these pathogens. The first one is bacteria. Bacteria cause infections by multiplying in large numbers. Bacteria need certain conditions to multiply, such as time, nutrients, moisture, and temperature. Bacteria will typically cause infections that disrupt the effectiveness of internal organs and biological systems, such as gastroenteritis and tuberculosis. Antibiotics and immunization can kill and control most bacteria. Some remain resistant to treatment and cannot be killed. Now let's look at viruses. Viruses are smaller than bacteria, and they can cause infections by multiplying in small numbers. Viruses can only survive within the human body. They do not live long outside the body. Viral infections include measles and chickenpox. Antiviral drugs and immunization can kill and control viruses. Antibiotics do not kill viruses. Finally, there's fungi. Fungi can appear as, for example, molds or yeasts. Some fungi affect the skin, others affect the whole body. Fungal infections result in the likes of an athlete's foot and skin conditions. Treatments are available for killing and controlling fungi.
Now that we have learnt about common pathogens, we should also learn how they spread. Well, there are 5 most common ways through which pathogens can travel from one person to another. These ways are body fluids, through the air, through touch, through ingestion, and through bites from other creatures.
Body fluids. A body fluid from one person, such as blood, urine, pus, or saliva, enters the body of another, for example through incisions or other means. Tetanus is a great example of transmission through body fluids. It can be contracted through wounds when handling contaminated soil due to contaminated substances entering the bloodstream. Another way is air. Tuberculosis is a great example of how pathogens spread through the air. Coughs and sneezes carry droplet infections via the air. These droplets can then be inhaled by others, leading to the transmission of the infection. An essential mode of transmission is through touch. Many infections can spread through direct physical contact with an infected individual, such as through skin-to-skin contact. Diseases like chickenpox are classic examples of illnesses that can be transmitted through this mode. Moreover, pathogens can also be spread by touching contaminated objects or surfaces that have been touched by an infected person. For instance, viruses like norovirus, notorious for causing winter vomiting infections, can linger on surfaces like door handles, paper, and kitchen implements. When we touch these contaminated objects and then touch our faces or consume food without proper hand hygiene, we risk introducing the pathogens into our bodies. Ingestion of contaminated food or water is another significant route through which infections can be transmitted. Pathogens like Salmonella and Campylobacter can contaminate food, especially if it's not cooked or handled properly. Similarly, waterborne diseases like cholera can occur when water sources become contaminated with bacteria or other pathogens. And finally, bites from creatures like dogs, cats, and insects can also serve as routes for infection transmission. Bites from domestic animals like dogs and cats can introduce bacteria into the body, leading to infections such as blood poisoning or sepsis. Insect bites, such as those from mosquitoes carrying the malaria parasite, can transmit diseases like malaria. Insect bites and stings can also trigger allergic reactions due to toxins present in the venom injected into the body.
Now we're going to delve into the intricate process through which infections proliferate. Understanding how infections spread is essential, not only for healthcare professionals, but for everyone concerned with safeguarding public health and preventing the spread of diseases within communities. A typical infection will spread by going through 6 stages, which are often known as the chain of infection by medical professionals.
First of all, a harmful pathogen causes an infection. After that, conditions and settings allow for the pathogen to multiply. Conditions also allow the pathogen to move from one site to another. Then, circumstances allow the pathogen to enter a human body. After that, the pathogen is also allowed to find an exit route from the host body. And finally, the pathogen passes from one human body to another. These 6 stages are: 1. A harmful pathogen causes an infection. 2. Conditions and settings allow for the pathogen to multiply. 3. Conditions also allow the pathogen to move from one site to another. 4. Circumstances allow the pathogen to enter a human body. 5. The pathogen is also allowed to find an exit route from the host body. 6. The pathogen passes from one human body to another.
As we conclude this module, we've laid a solid foundation by understanding the fundamentals of infection, spread, and control. In our next module, we'll delve into a crucial aspect of infection prevention, effective hand hygiene, which is a cornerstone of infection control, and mastering it can significantly reduce the risk of spreading harmful pathogens. We will also get an overview of managing infection risks. So, see you in the next module.